Over the next 20 minutes, you will hear about Brazil's healthcare system. First, we will discuss an overview of Brazil's healthcare system and some facts. Next, we will examine the strengths and weaknesses. Facts. Population. The population of Brazil was over 205 million in July of 2016. To compare, in Canada at the same time, the population was over 35 million. Infant mortality. Brazil's infant mortality was ranked the 94th highest in the world, with 18 deaths per 1,000 live births. In Canada, there were 179 with 4.6 deaths per 1,000 live births. Maternal mortality. In Brazil, there were 44 deaths per 100,000 live births, which ranks the 103rd highest in the world, compared to Canada's ranking at 147th in the world, which was 7 deaths per 100,000 live births. Life expectancy. Brazil's life expectancy is 73.8 years, ranked at the 127 in the world. Canada's life expectancy is 81.9 years and is ranked 19th in the world. The official language of Brazil is Portuguese. Brazil is the largest South American country, making it the 5th largest country in the world. Urban population. In 2015, 85.7% of the total population resides in urban centers. This is quite similar to Canada, where 81.8% of the population resides in urban centers. 21.4% of the population is below the poverty line. Unemployment rate is 9%. Inflation rate is 9% in 2015, 6.3% in 2014. It is the second largest health insurance sector in the Americas, after the United States, covering about 25% of the population in 2013.
Section 1. Overview of the healthcare system.
Brazil's healthcare system has gone through a number of changes throughout the years. In the 1900s, public health activities were first applied through public health campaigns in a military fashion. The autocratic nature of the campaigns and the lack of access to healthcare caused part of the population, some politicians, and even some military leaders to begin to resist. Then, in 1904, there was an official revolt when the Dictator General of Public Health, Oswald Kurz, placed a mandatory smallpox vaccine. From the 1920s to the 1930s, policies were made on individuals' social and civil rights based on their job in society. Then, in the 1930s to the 1945s, which was during the reign of President Vargas, decision-making and management was done without the public. During this time, the government invested little money in healthcare, therefore, vulnerable populations did not receive adequate healthcare. Also, during this period, the Ministry of Health and Social Security system was underfunded. Finally, in 1964, the military took over the government and there was an expansion in private healthcare in urban areas. Then, in 1970 to 1974, money from the federal budget was made available to improve and build private hospitals, which promoted expansion of medical care. Then in 1988, the revolt ended with a constitution established by the Federative Republic of Brazil, which stated health was a citizen's right and that the state was responsible for providing universal health care. The Constitution of 1988, created by the Federative Republic of Brazil, established healthcare as a right and responsibility of the government. This constitution established the Unified Health System, known as SUS, an administrative body responsible for the planning and managing of both the public and private health systems. SUS's purpose was to decentralize health responsibilities to the states and municipalities. Since the establishment of SUS, the number of healthcare facilities have grown from 22,000 in 1981 to 75,000 in 2009.
What are pros and cons of the SUS? The cons of the SUS include health system is largely decentralized, inefficient delivery of service and treatment. Family physicians only reach half of Brazilians. System is underfunded. Pros: The SUS is the biggest universal healthcare system in the world. All citizens have a right to healthcare. The SUS reduced issues such as maternal and child mortality, cardiovascular disease, and death by influenza.
A pass occurred in 1990 dividing the Health Council into 3 levels: federal, state, and municipal. In order for this structure to occur, there needs to be a certain ratio of stakeholders. 50% of the members must be users. This would include neighborhood associations or things like patient interest groups. 25% are represented by healthcare professionals and academic professionals, and 25% are healthcare providers that represent public and private. So this would include private firms, non-governmental organizations, and governments of different levels. They are all responsible to finance, monitor, deliver, and use health services. Mandate is to achieve equitable access to services for all citizens, established by the federal government through the Constitution. The mission is to improve health of populations by integrating and building partnerships with federal agencies, Brazilian states, municipalities, the private sector, and society to improve the quality of life and the exercise of citizenship, which was set by the Ministry of Health. The vision is to provide health for all, which developed towards the end of the military dictatorship by the government of Brazil, who in the past has worked hard to put into practice the 1978 Declaration of Alma-Ata, whose goal is achieving health for all.
Section 2. Analysis of the healthcare system.
Bohm et al. Distinguishes 3 core dimensions of healthcare systems: regulation, financing, and service provision. The hierarchical relationship between these 3 dimensions leads to a number of plausible healthcare system types. These are a national health service, a national health insurance, a social health insurance, etatis social health insurance, and a private health system. Using this classification, we have determined Brazil to have a national health service, in which the state has the highest power in regulation, financing, and service provision. To understand how healthcare is funded in Brazil, it's important to look at how the country is divided. Brazil is made up of 27 federative units, which is comprised of 26 states and 1 federal district. Each federative unit has about 214 municipalities, giving Brazil 5,570 total municipalities. The SUS is funded by several sources. It is 47% publicly funded through Social Security, the federal government, the federal district and states, and municipalities. Privately, it is 36% funded by out-of-pocket expenses from the people and 17% from insurance companies. Social Security is made up of money from employee and employer monthly contributions, general taxes, and other social contributions specifically designed for healthcare investment. The federal government spends a minimum of what was utilized the previous year and a nominal variation of the GDP. In 2014, Brazil spent 8.3% of their GDP, which is up from 3.76% in 2010. The federal district gives 12% and 15% of tax revenues from the state and municipality jurisdiction. States give 12% of their tax revenue, and each municipality gives 15% of their tax revenue. To sum up, the Brazilian healthcare system is comprised of public healthcare, which is free universal access, private healthcare, which is accessed by direct payment of services to the healthcare provider, and supplemental healthcare, which is made up of supplemental health plans, also known as insurance. The main regulatory body of healthcare is the Ministry of Health, which is an agency of the federal branch of government responsible for consolidating health practices in Brazil. It is made of 7 departments responsible for developing, proposing, and implementing health policy. Specifically, the Office of Health Services, or Secretariat of Healthcare, is responsible for evaluating health services through a National Health Council, which takes input from the stakeholders to find gaps in the system. 74% of the population rely on public access to healthcare. As stated previously, services are decentralized, which means all levels of government work together to implement policies and provide care. This method means healthcare services are largely managed by the municipalities. Although several initiatives are in place to expand healthcare coverage to meet the mission of health for all, dentistry, optometry, and pharmaceuticals are still mostly privately funded. The delivery of healthcare in Brazil is divided into three categories. Primary healthcare is the initial contact of healthcare and is the main focus of the system. This is done through the Family Health Program, which is publicly responsible for providing a full range of care to families in their homes, clinics, and hospitals, and provides care for 54.8% of the population. Community participation is key in the program's success, as input from community members are passed to municipal health councils. From primary healthcare, referrals are made to other levels. In secondary care, healthcare services are provided by health professionals who generally don't have first contact with patients and is usually done in hospitals. Most hospitals are privately owned, which makes equal access an issue since hospitals are more inclined to take in patients from supplemental health system because insurance companies pay more than the government. Tertiary care is specialized consultative care and is heavily dependent on privately owned facilities to perform. Specific guidelines for organ transplants and donations, oncology, and cardiac surgeries exist and are provided by private groups and paid for by the government. In summary, primary care is publicly delivered and secondary and tertiary care is both privately and publicly administered. In Brazil, there are 7,500 hospitals with 443,210 beds. 2,812 of these hospitals are public. On average, there are 1.95 doctors available per 1,000 people. Each year, Brazil spends $224 billion on healthcare, $5 billion on pharma, and $0.55 billion on imaging.
Section 3. Health status of the nation served.
Some of the health concerns of Brazilians are access to clean water, dengue, Zika virus, and the underfunded healthcare system. Brazil has 12% of the world's fresh water. Even with Brazil's plentiful water, 1/3 of the rural population does not have access to safe drinking water or sanitation facilities. In 2015, there had been severe drought in much of the country. Some cities in Brazil had to reduce the flow of water in several of the major pipes running throughout the city, resulting in a decrease in access of running water for thousands of people. According to a local who had to take her father to the emergency department in December 2015, there was no water in the hospital, nurses couldn't wash their hands, they were reusing bedding because there was no way to wash it. In 1934, the Water Code was established, which promoted the usage of water for energy but did not address on water usage in other aspects. In 1980 and 1990, the importance of water management within the code resurfaced. In January 1997, Congress in Brazil passed a law focusing on preserving water and making it available to the people in Brazil. The Congress also created a national water agency to aid in the management and protection of water sources. From 2007 to 2014, the Rio Grande do Norte State's Water Security Project was working to improve efficacy of water and increasing supply to poor rural communities. They created water supply systems in 33 small rural communities which supplied water to 3,700 beneficiaries and installed 125 desalination units to serve small communities, helping 8,900 families. In Brazil, there is also concern of dengue. Dengue is a viral disease transmitted through bites of infected mosquitoes. There has been an endemic in Brazil since its reemergence in 1981. In 2015, the rainy season had been particularly dry, resulting in severe drought throughout much of the country. In response to this drought, people have been storing water in large open containers in order to have access to water, which allows for ideal breeding grounds for mosquitoes. In order to try and control dengue, efforts have been made to improve surveillance, decentralized vector control, as well as laboratory diagnosis. Drug tents have been set up to treat patients in high-risk areas within the city. Health officials have been assigned to go door to door and educate residents on preventative measures, such as filling potted plants with sand, keeping containers dry and swimming pools covered, and placing mosquito nets over open water tanks. This mass education campaign has had limited success because individuals are wary about opening their door to strangers. As a result, soldiers have been trained to go door to door and provide this education in hopes to gain trust of the public and become more cooperative with the educational message. Zika virus has gained a lot of attention in Brazil. It is a virus that is transmitted by mosquitoes. Once someone is infected with Zika, it can also be sexually transmitted. Zika virus has been known to affect up to 20% of pregnancies and cause some form of brain damage to the baby in the womb. Zika virus also causes microcephaly in 1% of Zika-affected pregnancies. The CDC and WHO have partnered with Brazil to develop testing to confirm Zika in the first few weeks of illness. They are also working to be able to diagnose a prior Zika infection and develop a vaccine to protect people at risk, especially during pregnancy. As mentioned previously, cities in Brazil are working on preventative measures to control mosquitoes. The healthcare needs of Brazil are partially met. The public healthcare system is free and available to all Brazilian citizens. There's also a private system available for those who are able to afford it or have coverage through private insurance. Most of the private hospitals in Brazil have excellent medical facilities, and Brazil is one of the leading medical tourism destinations in South America. The government has recently declared a state of emergency and are in an economic crisis. This has caused stress on the public system. Public hospitals are forced to operate on minimal staff, resulting in treatment of only life-threatening cases. There has been an increase in job losses, which has caused a loss of private health insurance, therefore, an increased demand on the public system. Because of the increased stress and use of the public system, the government is unable to meet the needs of the citizens and are encouraging the citizens to use private healthcare system instead of relying on the public system. Currently, Brazil is in one of the deepest recessions in more than a century. As a result, there have been budget cuts to the public healthcare system. The Brazilian currency is weak, causing the cost of treatment and imported drugs and equipment to increase.
Currently in Brazil, we have two kinds of medical assistance. The government provides free healthcare for the people. However, such assistance can be poor, and a patient sometimes takes several months to schedule an appointment or procedure. Private companies can also provide healthcare services subject to a government inspection and specific rules. Due to the local economic growth from the past decades, many people that could only rely on the free public healthcare is now affording health insurance and other kinds of private medical assistance. Until 2014, only Brazilian companies were allowed to provide healthcare services in the country. Foreign capital was only allowed in very specific cases, even though foreign investments are pretty common in other industries in Brazil. In the beginning of 2015, a new law was created to finally allow such investments with no restrictions. The following fields are now covered by this permission: hospitals, human genetics, medication manufacture and supply, clinical pathology, and medical imaging laboratories. During the discussion of this new law, the government itself admitted that some new measures and private money would help the overloaded public healthcare system. Some local hospitals have been shutting down some units that are not profitable enough, such as maternities and pediatrics. Hence, new companies will have the opportunity to explore both mainstream and non-traditional medical fields.
Paim et al. 2011 sums up. Despite several limitations, the SUS has managed to vastly improve access to primary and emergency care, reach universal coverage of vaccination and prenatal care, and invest heavily in the expansion of human resources and technology, including major efforts to produce the country's most essential pharmaceutical needs.
Thank you for watching.